Hi, my name is Crystal Nelson. I'm an ergonomist at Alter Ergo, and today we're talking about lateral epicondylitis, or you might know it as tennis elbow. So, first question, what is tennis elbow? Tennis elbow is the inflammation of the tendons along the lateral aspect of our elbow. So when these tendons become inflamed, then that causes pain. So some research suggests that this inflammation is because of repetitive motions, maybe playing the piano with your hands pronated, typing. If you're a plumber, maybe a lot of turning and twisting, a lot of carpentry work. However, other studies are saying that who knows why tennis elbow occurs. So more research is currently being done to really figure out this answer. If you are experiencing tennis elbow, some of the things that you may recognize that if you hold your hand out forward and resist the back motion, that may cause more pain. That's a good sign that there may be some problems that need to be addressed. If you have a tough time holding a cup, if that's painful, or even doing turning motions, if that's painful, those are all signs that tennis elbow may be lingering. So definitely talk to your healthcare provider about getting these items figured out to figure out a better and more comfortable life for you. If you are experiencing some discomfort at your elbow, a lot of the times people with tennis elbow can easily pinpoint where that point is. So when I was in the rehab clinic, a lot of people could easily use one finger and say, oh, the pain is exactly right at this point. So if you are experiencing some discomfort at the lateral aspect of your elbow, definitely rest your arm and try to avoid the motions that are causing that pain. So if you are typing quite a bit, take a rest break. If you're playing piano, take a rest break. Apply ice to the area that is causing you some feelings of discomfort. If you do apply ice, make sure that you have a layer in between your skin and the ice pack itself. Frostbite can occur within minutes if you apply ice directly to your skin. So make sure you have that barrier in between the ice and your skin. And then apply it for 15 to 20 minutes at a time. You can do this multiple times a day. And what the ice does is it decreases the inflammation at the point that is inflamed. So lateral epicondylitis, itis means inflammation, so we have to get that down. If you catch these symptoms early on, you'll most likely have a quicker recovery. However, if you prolong the treatment, it can take weeks to recover from, sometimes a full year to fully recover. There are some other options for maybe long histories of tennis elbow, talking to a surgeon, or getting further up into the invasiveness of the treatment. When it comes to ergonomics, there are a few things to consider. So the more often you can keep your hands in a neutral position, so neutral is like holding a cup of water. So your hand is neutral, not pronated, not supinated. Your arms are by your side. You're in your comfort zone in front of you. Those are all indicators that you are in a neutral position. So the more often you can be in a neutral position, the better that will be for you. So if you are an office worker and you're typing, look at getting a keyboard that can put you into a more upright position, not splayed out, not pronated, but more upright and neutral. Same with your mouse. If you're mousing, a standard mouse puts us in a pronation position. Look for a mouse that puts you in neutral, and that will decrease the stress that is causing an awkward position within your arm. For office workers, also avoid holding onto your mouse too tightly. You should be able to just rest your hand on top of your mouse and use your large shoulder muscles to do the work to move your arm around. If you are doing manual work and are using hand tools, look for a hand tool that puts you into a neutral position as well. So think about a regular pliers. We have to turn our hand and ulnarly deviate our wrist, and that can cause a lot of strain at our forearm. So there are some pliers that are adapted that you can squeeze the handles with your hand in that upright position, and then the end of the pliers is still at the angle that you'd like to use it as. Same with power tools. Get those tools where you have your hand in a neutral position. If you do need to engage in a lot of force, use a lot of torque, look for two-handed power tools or a secondary handle that can be added to your tool so you can use both upper extremities to get the job done. When you're looking at hand tools, look for a diameter of the hand tool to be about 1 1/4 to 2 inches wide for a good power grip. The smaller grips cause you to pinch more, and that can cause more strain and fatigue in your muscles, where the larger 2-inch diameter, they can use your muscles to your benefit, and that way your body is being used exactly how it was designed to be used. There are also some great brands out there where you can substitute a manual tool for the use of a power tool. They are a little bit more costly to go that power tool route, but you can be more productive, you can get the job done with less manual tasks, and definitely save your body from discomfort. And then last but not least, consider items outside of your workplace too. So what are we doing within our daily tasks? Consider when you're driving. So make sure your hands are at 9 and 3 when you're driving, or 8 and 4, 7 and 5 is appropriate as well. Avoid keeping your hand at that upper 12 o'clock position, as that puts you into that pronation wrist position that we're trying to avoid. When you're using your cell phone, it's okay to use 2 hands instead of 1, especially if your phone is a little bit wider. You don't have to have such an extreme grip on a wider phone, so use your 2 hands to hold your phone lightly. Also consider what you're doing in the kitchen and meal prepping. So if you're chopping meats, vegetables, you name it, if you're using a standard knife, that puts you into a position where your wrist goes into ulnar deviation. Again, that's going to strain your elbow. So look for a knife such as a mezzaluna, a rocker knife, a T-shaped knife that can put you into a neutral position, and then you just rock across the item that needs to be cutting instead of having your wrist at that awkward position. If you are continuing to experience some feelings of discomfort at your elbow, I'm sure you're making an appointment with your healthcare provider, and also feel free to reach out to us. We're here to help you, and we can help take a look at your workstation and make sure everything is set up to how you would need it to be set up. For more additional tips and tricks, feel free to subscribe to this channel and check out our blogs on our website. Thank you.